Hello everybody, I'll be talking on glaucoma. So glaucoma, it is the silent theft of your sight. Okay. So what is glaucoma? Normally the eye produces a watery fluid which is called as the aqueous humor. Now this fluid is produced and drained out of the eye, and it maintains the normal intraocular pressure, which is the IOP, and the normal IOP being 10 to 20. So what happens in glaucoma? So in glaucoma, the aqueous humor which is produced is not drained out properly. Thus, the fluid gets accumulated in the eye. So once the fluid accumulates in the eye, the pressure increases in the eye. So this pressure which is increased causes a pressure on the optic nerve. So the optic nerve is an important nerve which transmits the signals from the eye to the brain. So the glaucoma causes an irreversible damage to this optic nerve, thus causing an irreversible damage to your vision. Therefore, a timely detection and treatment is very important. So who are at risk for glaucoma? Normally, above the age group of 40 years are affected, but anybody at any age group could be affected also. Patients with diabetes and hypertension are also at risk of developing glaucoma. Patients who have a family history of glaucoma or a genetic history of glaucoma are also at risk. Therefore, we recommend them to get yearly checked, ear eye checkup, and the intraocular pressure checked as well. So, what are the symptoms of glaucoma? So, normally a cataract or refractive error, the patient will come with the complaint of decreased vision. But in glaucoma, in early stages, there are rarely any symptoms. Okay, it's because the peripheral vision or your side vision is affected in glaucoma. You could also have headache or pain around the eyes, or there could be frequent change in your glass prescription. So, what are the different types of glaucoma? One is the open angle glaucoma, where the angle or the drainage where the aqueous goes out of the eye is open, but the structural changes causes an impaired uh, drainage of the aqueous, increasing the IOP. Next is a narrow angle or a closed angle glaucoma. The drainage area where is narrowed down or closed down, thus impairing the outflow of this aqueous and increasing the pressure. Next is the normal tension glaucoma. So here the normal tension, which is the 10 to 20, is normal, but yet you could have glaucoma because of the optic nerve damage. Others are childhood or congenital glaucoma. Next is the secondary glaucoma, which could be because of the other conditions in the eyes and causing the rise in intraocular pressure. So, how do we detect or test for this glaucoma? Okay, tonometry, it's a special device, okay, which measures the intraocular pressure of the eye. Next is the ophthalmoscopy, where we check for the retina status and the optic nerve changes. Perimetry. Perimetry, it's a special device where we check for the peripheral vision loss, and the machine maps out the defects which are caused by glaucoma. Pachymetry. Pachymetry is where we measure the thickness of the cornea being the outermost layer of the eye, whether it is thick or thin. Depending on that, we check the IOP or we correct the IOP. Next is the gonioscopy. By doing gonioscopy, we see for the drainage angle whether it is open or it is closed, and we decide on the type of glaucoma. Next is the OCT. OCT is the optical coherence tomography, where we scan for the optic nerve. okay, the optic nerve thickness and the damage which is caused by glaucoma. Okay, so what is the treatment for glaucoma here? So the permanent damage which has been caused by glaucoma is not reversible by the medications or surgery. But yes, these medications and surgery are given, or it has is done to prevent further damage or to maintain the remaining vision which is there. Okay, so medications in the form of eye drops have been given to reduce or to control the intraocular pressure. These have to be taken regularly, just how you take your diabetic and hypertensive medications. These all also have to be taken regularly and not skipped a single day. Okay. Surgical procedures like the laser or the trabeculectomy, which is the common surgery, or the glaucoma shunts which have been placed, they reduce the intraocular pressure or they maintain the intraocular pressure, which prevent the further damage caused by glaucoma. So, if you have been diagnosed with glaucoma, please follow up with your eye doctor regularly, and if not, please we request all our patients to get your eye tested yearly along with your intraocular pressure, so that glaucoma, which is the silent theft of your sight, does not steal your vision. Thank you.